Across Minnesota, communities large and small have faced many public health challenges, from substance use and drug overdose to human trafficking. Today, learning how these complex issues are connected can teach us how to solve them. That's why the Minnesota Department of Health is expanding its efforts to unite treatment providers, empower collaboration, and get urgent support to those who need it the most.
When working to help address human trafficking and substance use, it's critical to have a multi-pronged approach. While our systems are designed with certain mechanisms and structures, we have to have blended approaches and multidisciplinary solutions.
It's crucial that we look at the overlap between substance use and human trafficking and exploitation, both sex and labor, because we see through the research and through the experiences of survivors that substances play a really big part in this form of trafficking and exploitation. For example, Polaris is our national hotline that receives calls from all over the country about human trafficking. And the top means of force, fraud, and coercion, as they termed it, is substance use and human trafficking.
In our recent report, our 2023 preliminary overdose data report, it is showing that overdose deaths are going down across the state. But this report is also showing that African Americans and Indigenous folks overdose at higher rates than their white counterparts. And so those are the communities that are most impacted by substance use and overdose. And these are the same two communities are often impacted by human trafficking and exploitation.
Labor trafficking involves a worker who, through force, fraud, or coercion, feels that they can't stop or leave the job that they're in. That some trafficker could be their employer, a supervisor, a family member, a gang member, is compelling them to work through threats of physical violence, through psychological manipulation. It could be debt bondage, where the debt is forcing the worker to keep working for free, but it never really gets paid off. A trafficker may force someone to engage in some kind of criminal activity. I think the most common one that we think of is commercial sex.
Commercial sexual exploitation occurs when somebody is trading sex for something of value, like a place to stay. It could be for money. It could be for substances. Sex trafficking involves situations when there is a facilitator who is trafficking somebody else, marketing that person.
Commercial sexual exploitation and substance use is prevalent amongst our Minnesota youth. According to combined data from the Minnesota Student Survey, 1.3% of youth answered yes to trading sex. 13.4% answered yes to using substances. 0.9% of students answered yes to both trading sex and using substances. While this MSS data does not tell us exactly how these experiences overlap, it tells us that they do.
Because so many drugs are illegal, you get an overlap in which using someone's substance use disorder against them might be linked to also forcing them to participate in buying and selling and cultivating drugs. If a trafficker withholds a drug or alcohol, withholds medicine to help in treatment, maybe provides it and uses that provision as a way to control the individual. And so all of those can be manipulated to keep someone trapped in a work situation. And so you see a lot of overlap in those cases. There could be something beyond that in which their substance use disorder is actually being impacted by trafficking that they don't even know how to disclose or describe.
A lot of my clients were coming to me with a bunch of drug charges and things like that that were making a lot of barriers for them to get access to stable housing and jobs. How can we better identify and respond to this issue in outstate Minnesota, where we don't have necessarily funded task forces to identify and respond to these cases?
There's a lack of understanding, I think, on why folks choose substances, and how individuals stay addicted. And there are similar stigmas around sexual exploitation. And that really plays a large part in whether or not folks are willing to come forward and talk about what they've experienced. So these negative beliefs are things that our clients may have about themselves from larger society, maybe from their community, and even from family members.
And a lot of times the survivor is too afraid to call out the trafficker to law enforcement because they've been told that they might be harmed. And they have sometimes had negative repercussions with experiences in the foster care system, potentially losing children in child protection systems. And so it's all understandable and well-founded that survivors have these fears, but traffickers also prey upon those fears and use them as another level of manipulation.
I think it's important for us to look at our country's history. There's a stigma associated with a woman if she is selling her body or if she is being exploited. Our history is deeply intertwined with exploitation and human trafficking, particularly for African Americans, Black women, Indigenous women, and girls.
In my spirit, this is like a human issue. So it's really important to center our humanity when we're working across systems. We must center the whole person and meet folks where they're at in terms of their lived experience.
Trafficking victims who are in a controlling situation know best what is going to keep them safe and what they need to help them. And that may mean that they're going to return to a harmful situation until they feel that they have the resources and the ability to leave safely. So we want to really emphasize their ability to make those decisions for themselves.
People being the experts of their own bodies, their own experiences. Somebody who uses drugs, that in itself carries a stigma. But if that person is also incarcerated, if that person is also homeless, those stigmas, they overlap. Ultimately, that's the folks that are going to be impacted by a lot of the work that we're doing. And so really taking that community knowledge and that community expertise and leveraging and working with those folks to build a better system for them is extremely important.
Our Minnesota response is rooted in a public health approach because we recognize that the needs of survivors are really health needs. We can create opportunities and responses that are based on key public health principles like harm reduction and health equity.
Harm reduction is around us in lots of different ways. It's really giving folks the tools they need to stay as safe as possible. I specifically work with syringe service programs. They distribute naloxone, which is an opioid antagonist. They do syringe disposal, which is huge, making sure that folks have access to new injection drug equipment to prevent the spread of HIV. We have a syringe service program calendar, which kind of shows the layout of where folks can receive services, offering different resources, treatments, and referral. And so it gives us a really clear picture as to where the service is being provided, but also where those gaps that we want to fill.
Minnesota's Safe Harbor response, we serve as central points of entry for anyone looking for services for individuals who are at risk of or experiencing sex trafficking, sexual exploitation, and labor trafficking. We also have housing providers, youth advocates, and we have a myriad of other services and programs across the state as well.
We currently have 10 regions and 2 tribal regional navigators. So regardless of what area of the state you're in, you have a designated individual that you can always maintain contact with when you have questions, concerns, are in need of consult, resources, education for, again, all different types of commercial sexual exploitation. I really had a lot of success and luck partnering with some of our drug enforcement units throughout my region and throughout the state. We worked on how do we really identify who's a potential victim when we're coming into contact with people related to drugs, and how can we better offer them services in lieu of more charges and jail stays.
People who are being prosecuted for drug-related offenses might actually be in that position because they are a victim of trafficking. And we don't do a good job in those situations recognizing that trafficking may be driving that behavior. This can change, and it can change when people talk about the reality of what this looks like in people's lives, working at the community level, talking to your local law enforcement agents, advocating for clients or the people that you're serving to say, this is something bigger than what it appears on the surface.
Many communities in our state still don't have human trafficking services, and they also don't have a substance use response either. We're a big state. We have 87 counties. We have 11 tribal nations. It's really hard to get sometimes to services. This is one of the biggest reasons why people tend to slide back in to using or to going back to situations in which they are just trying to survive. And so when we spread out and we partner with law enforcement, when we partner with prosecution, healthcare, child welfare, housing providers, other types of social services, then we are actually always bringing public health to the table, because our end goal is really health and well-being for survivors.
I would love to have something readily available. So if somebody who is experiencing, domestic violence or sexual violence steps into one of our certain service programs, they immediately have all of the resources they need. I think there is an opportunity to learn from each other because we all are working with very similar folks.
This has been a situation of steady progress. When we go out and train people, there's a dramatic increase in the number of victims who are identified and are able to get services and are able to improve their situation. So learning about this issue is already a step to a better place.
Communication, education, raising awareness. This is public health. We can make sure that no one dies of an overdose, because overdoses are preventable, right? So we can make sure that everyone that we come in contact with has access to naloxone, fentanyl test strips, and they know how to use them.
Trafficking doesn't happen in a vacuum. And so if we only try to treat or assist one component of somebody's life, we're really not going to get to the root of the problem and help create a foundation that allows somebody the stability that they need to leave substances, leave a exploitive or abusive relationship.
Definitely stay in contact with the Safe Harbor Network, reach out to their regional navigators about prevention opportunities. It really does take a community to create community change.
We can increase peer support models and invest in survivor-led services, meaningful, ethical, and paid opportunities for individuals with lived experience to lead us in the right direction.
We have the opportunity to work with public health in partnership with public safety and work on the local level with community-based organizations. It's our challenge to rise to the occasion.
We can continue to educate the community, that we can build up our prevention responses to build a more hopeful future for the survivors that we support.